When first broaching the subject of tapering a patient off of chronic opioid therapy, particularly for those patients who have been taking high doses for months to years, be sure to schedule enough time for the patient visit. These kinds of difficult conversations can't be rushed. When we attempt to hurry through this important initial conversation, patients are liable to feel angry and abandoned, which in turn adversely affects the therapeutic alliance. Maintaining an effective and compassionate therapeutic alliance with patients is critical to the success of the opioid taper. Remember that even suggesting an opioid taper will trigger extreme anxiety in many patients to the point where they may temporarily lose their ability to fully attend to what we are saying. To mitigate the anxiety, try identifying the feelings for patients, normalizing it, and expressing empathy. For example, we might say,
"Hi, Mrs. Smith. I scheduled some extra time for us today because I want to discuss a very important topic with you. I've been thinking a lot about your chronic pain and how to help you with that, and would like to suggest we taper you down and maybe even off your opioid medication. Now, I know the very thought of an opioid taper is terrifying for you, and you're not alone in that. It's totally normal to feel afraid about going down on your dose, especially after you've been taking opioids for so long. But please hear me out, and let me tell you the reasons why I think it's a good plan for you."
Note here how we tell the patient, "I've been thinking a lot about your chronic pain." This is an important and multi-layered communication. With this phraseology, we are communicating to the patient that the opioid taper was carefully considered and not an impulse or some form of retaliation. We're telling the patient we keep him or her in mind even when we're not with them. They exist for us outside of the clinic environment. Or, as the famous psychoanalyst Donald Winnicott might say, we create a holding environment for the patient to feel safe. By arranging for enough time to discuss this delicate topic and anticipating the patient's strong emotional reaction to the suggestion of the taper, we increase our chances of preserving a good therapeutic alliance and hence a more successful taper experience. Laura's story illustrates how failure to have an effective initial discussion about the plan for a taper leaves patients feeling anxious and desperate, wondering how they will cope.
I could tell it was worse. I knew about, that opiates could make you more sensitive to your pain or that you get rebound pain and things like that. But I was just so scared to not take them because I felt, well, this is my pain. When I'm not on them, there is no way I could survive.
In Laura's case, her anxiety contributed to a psychiatric hospitalization, all precipitated by the lack of a clear plan for getting off of opioids.